Hello, ENA family. My name is Heidi Gilbert, and it has been one of the greatest honors of my professional life to serve on the ENA Board of Directors over the last 3 years. I am an emergency nurse, forensic nurse, educator, and advocate from Stillwater, Oklahoma. I've been a nurse to close to 30 years with over 20 years in the emergency department. I currently serve as the clinical educator and SANE program coordinator at Stillwater Medical Center. Throughout my career, I have been deeply passionate about caring for vulnerable patients, particularly victims of sexual assault, strangulation, and domestic violence. Having lost my sister to substance abuse and domestic violence, caring for and advocating for this population is incredibly personal and important to me. During my time on the ENA board, I worked hard to stay connected with members at every level. I've had the privilege of serving as liaison to state councils, participating in advocacy on Capitol Hill, and helping support one of the most significant moments in ENA history, the integration of the International Association of Forensic Nurses into the ENA family. I truly believe this partnership represents the future of both emergency and forensic nursing. Emergency nurses are already caring for forensic patients every single day, whether they realize it or not. I'm proud of the work we've started, but I also know there is more work to do. And that's why I'm asking for your support for another term on the ENA Board of Directors. I'm seeking re-election because I believe ENA matters now more than ever. Emergency nurses are navigating extraordinary challenges: workplace violence, moral injury, overcrowding, staffing shortages, behavioral health crises, and increasing patient acuity have fundamentally changed what it means to work in the emergency department. I want to continue serving because I deeply care about protecting and advocating for this profession. Over the last 3 years, I've worked to bring members' voices to the boardroom. I still work closely with nurses facing these challenges every day, and I understand what it feels like to care for patients in hallways, to experience compassion fatigue, and to wonder how we sustain this workforce long term. One area I'm especially passionate about is the continued integration of forensic nursing within the ENA. I was honored to help support the work surrounding the IAFN acquisition, and I believe we are only at the beginning of realizing the potential of what this partnership can become. Forensic nursing is emergency nursing. Nurses care for victims of violence every single shift, often without formal education, resources, or support. We have an incredible opportunity to equip emergency nurses with trauma-informed care principles, forensic knowledge, strangulation education, and human trafficking recognition and evidence-based approaches that improve outcomes for patients and communities. I also care deeply about leadership development and mentoring the next generation of emergency nurses. ENA changed my life professionally, and I want to ensure other nurses feel that same sense of belonging, growth, and purpose within this organization. If reelected, I will continue advocating for members, supporting innovation and education, strengthening relationships across specialties, and helping ensure ENA remains bold, relevant, and future focused. One of the biggest challenges facing emergency nurses today is that we are being asked to carry more than ever before, emotionally, physically, and professionally. Emergency departments have become the safety net for nearly every gap in our healthcare system. We are caring for critically ill patients mourning for hours or days, increasing behavioral health emergencies, victims of violence and trauma, public health crises, substance use disorders, and communities with limited access to care. And despite all of that, emergency nurses continue to deliver extraordinary care. But the reality is, this pace is not sustainable without support. Workplace violence remains a major issue. Moral distress and burnout are real. Many nurses feel exhausted, undervalued, and emotionally depleted. One of our greatest opportunities is to better support nurses through education, mentorship, advocacy, and healthy work environments. We need to continue fighting for safe workplaces, appropriate staffing, mental health support, and strong professional development opportunities. I also think we must continue expanding how we define emergency nursing. Emergency nursing is no longer limited to traditional trauma and medical emergencies. It includes forensic nursing, behavioral health, disaster preparedness, public health, and community violence intervention. The integration of IFN into ENA is an example of that future. It recognizes that caring for victims of violence is not separate from emergency nursing, it is central to it. Finally, I believe we must remain united as a profession. Emergency nurses are incredibly diverse in geography, experience, special interests, and practice settings, but we are strongest when we come together around our shared mission of providing exceptional care to patients on some of the hardest days of their lives. I would be honored to continue serving and advocating for you, and I sincerely appreciate your trust, your support, and your vote.